So I asked that open-ended question, what drugs should you know as an entry-level PTA? And I put out a pretty good list for you, I think, in terms of talking to Aaron Jobes from Pacific University, their DPT program, and just from looking at the study guides for the licensure exam and using those sources as information to help guide what drugs you should know, and also just from practice and from having those conversations with different healthcare providers who are familiar with the role of the PTA. In short, it's important to certainly be familiar with these various drugs because of the adverse drug reactions that can take place, and also to know the role of exercise regarding these different types of drugs, and then also the timing of therapy and response to the drugs. In other words, such as levodopa, the classic, or at least the more contemporary practice, is that you need to wait at least a half an hour. Now, there may be some different types of substrates, or that's not the best word, but there may be some newer drugs that are part of that levodopa classification that may take effect a little more quickly with patients who are taking that for Parkinson's, for example. So if you have questions about that, certainly talk to the nurse, or if you have pharmacists on staff, you can always ask them that question. The nurse would be the best source if they're available, simply because they're available and they have the medications with them, which actually says, how long that drug takes to be present within the system, right? And to take its desired effect. And certainly looking up Hippocrates or some other reputable websites, including the APTA source, will help you with those questions as well. But if you're ever in any doubt and not sure, and you have the nurse or pharmacist available, those would be your best sources. So I think this is really good because it really looks at some of the drugs that are used for specific neurological health conditions. You've been exposed to some of these from PTA 204, and you've learned these as well in your pharmacology class, so I'm not going to go through them. But I really like what I put in there regarding that therapeutic window in terms of where you're going to get the better, that therapeutic window where you're going to be able to advance that patient the most, and when they're going to be able to work to their maximum. I really think it's cruel to work with a patient that is on a prescribed drug for movement and try to get them to move before that drug takes effect. I think it's mean, actually. Unless there's some medical reason or a reason you have to get them moving because of, for example, maybe a fire alarm going off or an evacuation of the building. But there should always be that opportunity to reschedule them, or to give the patient time for that drug to take effect, so you can maximize the therapeutic benefit for that patient. Otherwise, you're going to have a setback in regards to their progress, and it can be very demoralizing to the patient, as well as just increasing the workload and demand on you as well as the patient. There's more and more drugs or not more and more drugs, but more and more patients are being prescribed drugs for sleep disorders. This can have adverse drug reactions and problems with your treatments, especially if they're taking drugs during the daytime and they are half asleep. You increase the safety risk when someone is not able to be fully present because they're on a sedative or something that's going to make them very sleepy. So keep that in mind and proceed with caution. Then we have, the anti-anxiety drugs, and you're probably familiar with all these drugs already from your pharmacology classes, but you definitely need to review the material. And I think, the important role, as you learned last term in mental health, as we talked about some of the health conditions such as bipolar as a health condition, as well as schizophrenia, and then some of the major depressive disorders, health conditions, the important role aerobic exercise can help in terms of managing those health conditions as a supplement to pharmacology, but in some cases as a way to assist in removing a person from a particular drug. And you never want to just promise people this is what's going to happen, because then you'll be setting yourself up for failure and the patient up for failure for making a promise you can't keep. But the important thing is that exercise can really help manage some of these health conditions related to even insomnia in some cases, and certainly with some of the more milder forms of anxiety. And just developing, that conversation of education with people if they're having sleep problems, of other ways to induce better sleep patterns. We call it sleep hygiene. And that's an important term to know. Alcohol can make sleep more difficult, and we all know that there tends to be pretty easy to get access to alcohol in our contemporary society. I need to probably do more research on marijuana, because it's a newer legal classification or drug in Oregon, and I just don't have a lot of up-to-date information on marijuana use to include it in the lecture, but maybe next year, right? And then you've, again, probably learned this information in your pharmacology classes about the heart performance being affected by certain drugs. The implications of the PTA here is really important for you to know. So I would really kind of spend some time on this information. There's so many drugs that are out there for cardiac conditions, heart conditions. And then, just that whole information about some suggestions for the PTA. This is a really good, important section that, again, has been vetted within our physical therapy community among PTs and those that have high expertise in pharmacology from advanced education and degrees. So I'm going to leave it from there. I hope you really have embraced this information as much as I have, and helping you be more effective as a PTA, more greater value to your patients as a result of taking this course.